Today we will discuss about Zetro, which contain azithromycin. Description: Azithromycin is nitrogen-containing macrolide or azolide for oral administration. The molecular formula is C38H72N2012. Qualitative and quantitative composition. Azithromycin is available for oral administration as Azithromycin USP, 250 mg capsules, as dihydrate. Azithromycin USP, 500 mg film-coated tablet, as dihydrate. Azithromycin USP, 200 mg per 5 ml. Clinical pharmacology. Mechanism of action. Azithromycin exerts its antibacterial action by binding to the 50s ribosomal subunit of susceptible organisms and thus interfering with microbial protein synthesis and inhibition of peptide translocation. Nucleic acid synthesis is not affected. Pharmacokinetics. Following oral administration, about 40% of the dose of azithromycin is bioavailable. Absorption from the capsule formulation is reduced by food, but there is no significant effect on the bioavailability of tablet formulation even after a high-fat meal. Peak plasma concentrations are achieved 2 to 3 hours after a dose, but azithromycin is extensively distributed to the tissues and tissue concentrations subsequently remain much higher than those in blood. High concentrations are taken up into white blood cells. Small amount of azithromycin are demethylated in liver and it is excreted in bile as unchanged drug and metabolites. About 20% of the amount in the systemic circulation is excreted in the urine. The terminal elimination half-life is probably in excess of 40 hours. Special populations. Renal insufficiency. Following a single dose of azithromycin 1 gram orally, the pharmacokinetics in subjects with mild to moderate renal impairment, glomerular filtration rate 10 to 80 ml per minute, were not affected. Significant differences in area under curve, max, and creatinine clearance were observed between subjects with severe renal impairment, glomerular filtration rate less than 10 ml per minute, and subjects with normal renal function. Hepatic insufficiency. In patients with mild, Class A, to moderate, Class B, hepatic impairment, there is no evidence of a marked change in serum pharmacokinetics of azithromycin compared to those with normal hepatic function. Microbiology. Azithromycin has been shown to be active against most isolates of the following microorganisms, both in vitro and in clinical infections. Aerobic and facultative gram-positive organisms. Streptococcus pneumoniae, penicillin-resistant, penicillin intermediate, Streptococcus pyogenes, Staphylococcus aureus, Streptococcus agalactiae, Streptococci, groups C, F, G, viridans group Streptococci, Corynebacterium diphtheriae. Azithromycin demonstrates cross-resistance with erythromycin-resistant gram-positive strains, including Streptococcus faecalis, Onchococcus, and most strains of methicillin-resistant Staphylococci. Aerobic and facultative gram-negative organisms. Haemophilus tuckerii, Haemophilus influenza, Moraxilla catarrhalis, Neisseria gonorrhoeae, Bordetella pertussis, Legionella pneumophila, Haemophilus parainfluenza, Acinetobacter species, Yersinia species, Shigella species, Pasteurella species, Vibrio cholerae and Parahemolyticus, Plesiomonas shigelloides. Anaerobic microorganisms Peptostreptococcus species, Prevotella bivia, Bacteroides fragilis and Bacteroides species, Clostridium perfringens, Peptococcus species, Fusobacterium necrophorum and Propionibacterium acnes. Others Chlamydia pneumoniae, Chlamydia trachomatis, Mycoplasma pneumoniae, Ureaplasma ureolyticum, Escherichia coli, Salmonella, Shigella species, Mycobacterium avium, Mycobacterium intracellulare Toxoplasma gondii, Plasmodium falciparum. Therapeutic indications. Azithromycin is indicated for the treatment of patients with mild to moderate infections caused by susceptible strains of the designated microorganisms in the specific conditions listed below. Lower respiratory tract infections, acute bacterial bronchitis and community-acquired pneumonia in patients suitable for outpatient oral treatment and in patients who require initial intravenous therapy. Upper respiratory tract infections, acute sinusitis, acute streptococcal pharyngitis/tonsillitis and acute otitis media in children. Uncomplicated skin and skin structure infections. Sexually transmitted diseases, uncomplicated urethritis and cervicitis. Antimicrobial agents used in high doses for short periods of times to treat non-gonococcal urethritis may mask or delay the symptoms of incubating gonorrhea or syphilis. All patients with sexually transmitted urethritis or cervicitis should have a serologic test for syphilis and appropriate cultures for gonorrhea performed at the time of diagnosis. Appropriate antimicrobial therapy and follow-up tests for these diseases should be initiated if infection is confirmed. Pelvic inflammatory disease in patients who require initial intravenous therapy. Chlamydia trachomatis conjunctivitis and trachoma in adults and in children 12 months or older. Prophylaxis and treatment of disseminated Mycobacterium avium complex, MAC, disease in adults and children aged more than 12 years. Dosage and administration. Azithromycin tablets and oral suspension can be taken with or without food. The capsule formulation should be given at least an hour before or 2 hours after meals. Adults. For all indications except for those given below, the usual adult dose of azithromycin is 500 mg as a single dose daily for 3 days. Alternatively, an initial dose of 500 mg may be followed by 250 mg daily for a further 4 days. Sexually transmitted uncomplicated urethritis and cervicitis, 1 gram as a single dose. Conjunctivitis and trachoma due to Chlamydia trachomatis, 1 gram either as a single dose or once weekly for up to 3 weeks. Treatment of community-acquired pneumonia following 4 therapy, 500 mg as a single daily dose to complete a 7 to 10 day course of therapy. Treatment of pelvic inflammatory disease following 4 therapy, 250 mg as a single daily dose to complete a 7 day course of therapy. Prevention of disseminated Mycobacterium avium complex disease in adults with HIV infection, 1200 mg taken as a single dose once weekly, either alone, or in combination with rifabutin, at its recommended dosage. Treatment of disseminated Mycobacterium avium complex disease in adults with HIV infection. Azithromycin should be taken at a daily dose of 600 mg, in combination with ethambutol at the recommended daily dose of 15 mg per kg. Children. Azithromycin should be used for children under 45 kg. The dose in children is 10 mg per kg as a single daily dose for 3 days. Alternatively, 10 mg per kg as a single dose on the first day followed by 5 mg per kg per day on days 2 to 5. Conjunctivitis and trachoma due to Chlamydia trachomatis in children 12 months or older, 20 mg per kg either as a single dose or once weekly for up to 3 weeks. Prevention of disseminated Mycobacterium avium complex, MAC, disease in children aged more than 12 years with HIV infection, 1200 mg taken as a single dose once weekly, either alone, or in combination with rifabutin, at its recommended dosage. Streptococcal pharyngitis and tonsillitis, 20 mg per kg once daily for 3 consecutive days providing a total dose of 60 mg per kg over a 3-day treatment period. Do not exceed a daily dose of 500 mg, or 12.5 ml of the reconstituted powder for oral suspension. Acute otitis media, total dose of 30 mg per kg given as 30 mg per kg as a single dose or 10 mg per kg once daily for 3 days or 10 mg per kg as a single dose on the first day followed by 5 mg per kg per day on days 2 to 5. Acute bacterial sinusitis. The recommended dose of azithromycin for oral suspension for the treatment of pediatric patients with acute bacterial sinusitis is 10 mg per kg once daily for 3 days. Community-acquired pneumonia. The recommended dose of azithromycin for oral suspension for the treatment of pediatric patients with community-acquired pneumonia is 10 mg per kg as a single dose on the first day, followed by 5 mg per kg on days 2 through 5. Directions for preparing. Oral suspension. To prepare 15 ml suspension, add 7.5 ml boiled cooled water to the powder by using the given measuring device and shake well to dissolve the powder. Discard any unused portion after 10 days. Adverse reactions. Very common. Diarrhea, abdominal pain, nausea, and flatulence. Common: lymphocyte count decreased, eosinophil count increased, anorexia, dizziness, headache, paresthesia, dysphagia, deafness, vomiting, dyspepsia, rash, pruritus, arthralgia, fatigue, and blood bicarbonate decreased. Uncommon. Candidiasis, oral candidiasis, vaginal infection, leukopenia, neutropenia, angioedema, hypersensitivity, nervousness, hypoesthesia, somnolence, insomnia, hearing impaired, tinnitus, palpitations, gastritis, constipation, hepatitis, aspartate aminotransferase increased, alanine aminotransferase increased, blood bilirubin increased, Stevens-Johnson syndrome, photosensitivity reaction, urticaria, blood urea increased, chest pain, edema, malaise, asthenia, and blood potassium abnormal. Rare. Thrombocytopenia, hemolytic anemia, agitation, depersonalization, vertigo, hepatic function abnormal, renal failure acute, and nephritis interstitial. Contraindications. Azithromycin is contraindicated in patients with known hypersensitivity to azithromycin, erythromycin, any macrolide or ketolide antibiotics. In patients with a history of cholestatic jaundice/hepatic dysfunction associated with prior use of azithromycin. To use concurrently with ergot derivatives. Precautions. Azithromycin should not be used in patients with pneumonia who are judged to be inappropriate for oral therapy because of risk factors such as patients with cystic fibrosis, patients with nosocomially acquired infections, patients with known or suspected bacteremia, patients requiring hospitalization, elderly or debilitated patients, patients with significant underlying health problems that may compromise their ability to respond to their illness, including immunodeficiency or functional asplenia. No dose adjustment is needed in patients with mild or moderate renal impairment. Caution should be exercised when azithromycin is administered to patients with severe renal impairment, glomerular filtration rate less than 10 ml per minute. Since azithromycin is metabolized in the liver and excreted in the bile, the drug should not be given to patients suffering from severe liver disease. As with any antibiotic preparation, observation for signs of superinfection with non-susceptible organisms including fungi, is recommended. Ventricular arrhythmias associated with prolonged QT interval, including ventricular tachycardia and torsades de pointes, have been reported with macrolide products. Azithromycin should be used with caution in patients predisposed to QT interval prolongation or in patients taking other medications known to prolong the QT interval. Clostridium difficile-associated diarrhea has been reported with use of nearly all antibacterial agents, including azithromycin, and may range in severity from mild diarrhea to fatal colitis. If Clostridium difficile-associated diarrhea is suspected or confirmed, ongoing antibiotic use not directed against Clostridium difficile-associated diarrhea. Difficile may need to be discontinued. Pregnancy. There are no adequate and well-controlled studies in pregnant women. Therefore, azithromycin should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Nursing mothers. It is not known whether azithromycin is excreted into human milk. Azithromycin should only be used in lactating women where adequate alternatives are not available. Drug interactions. Antacids. In patients receiving both azithromycin and antacids, the drugs should not be taken simultaneously. Azithromycin should be taken at least 1 hour before or 2 hours after the antacid. Cyclosporin. Caution should be exercised before considering concurrent administration of these drugs. If co-administration of these drugs is necessary, cyclosporin levels should be monitored and the dose adjusted accordingly. Theophylline. Theophylline levels may be increased in patients taking azithromycin. Coumarin-type oral anticoagulants. Consideration should be given to the frequency of monitoring prothrombin time, when azithromycin is used in patients receiving coumarin. Type oral anticoagulants. Digoxin. In patients receiving concomitant azithromycin, a related azolide antibiotic and digoxin, the possibility of raised digoxin levels should be borne in mind. Overdose. Adverse events experienced in higher than recommended doses were similar to those seen at normal doses. The typical symptoms of an overdose with macrolide antibiotics include reversible loss of hearing, severe nausea, vomiting and diarrhea. In the event of overdose, the administration of medicinal charcoal and general symptomatic treatment and supportive measures are indicated as required. Storage. Store at 25 degrees Celsius, excursions permitted between 15 degrees Celsius minus 30 degrees Celsius, protect from sunlight and moisture. The expiration date refers to the product correctly stored at the required conditions. Thank you to watch my video. Please like and subscribe my channel. Thank you again.